Safety recommendations are developed by expert groups who look at the total body of scientific evidence and is from that establish the threshold at which adverse effects occur, and from that then in turn develop safety factors and exposure limits. So if we take the situation with radio frequency fields, there's been about 50 years of research in this area. You have international scientific committees who review that research, from that determine the critical threshold at which effects are observed. They then incorporate a safety factor of 10 for worker exposures and a further safety factor of 5 for public exposures. So the maximum exposure for the public is 50 times below the threshold at which effects have been established. Those threshold effects, they're developed in terms of the absorbed energy in the body. So in order to make that meaningful from a compliance point of view, those figures are turned into measurements of electric field or magnetic field or power density that can be measured by compliance engineers for a base station or for a mobile phone. Typically in the community, exposures from radio networks are many thousands of times below the safety standards, and those safety recommendations include substantial safety factors, so that in terms of where the established effects are and where public exposure is, there's a very large gap, and that should give great confidence to the community in the safety of radio services. The standards themselves and the guidelines are kept under regular review so that the expert committees can keep account of changes in science, in new findings, and whether there are new technology reasons to change the exposure limits and to incorporate those into the safety standards. I guess it's important to distinguish as well between safety recommendations, which are the fundamental exposure limits, the limitation on the amount of energy that might be absorbed, and then compliance standards. And they are the technical standards used to determine that the exposure is less than the safety standard.